Good afternoon. First, my prayers are with the patients and their families after this terrible incident. I want to first thank my colleagues in the pre-hospital professions, police, fire, and EMS. They rapidly worked to give the patients in this incident the best chance at recovery. ECMC is the only adult Level 1 trauma center for Western New York. We plan, we train, and we are prepared to implement our plans for mass casualty incidents, which we proved today. We rapidly evaluated 24 patients from this incident this afternoon. I want to thank my colleagues from trauma surgery and emergency medicine and others who helped rapidly decompress our emergency department so that we could efficiently treat the influx of injured patients. Also, thank you to several ECMC ER doctors who actually went to the scene to help triage patients at the scene. Thank you to our nurses, pharmacists, and all their staff that proved today what an asset ECMC is for Western New York. Lastly, thank you to our partners at Kaleida Health who coordinated with us and received patients to help keep us decompressed. Thank you.
Thank you, Dr. Cloud. Our next speaker is our Chief of Emergency Medicine, Dr. Jennifer Pugh.
Hi, my name is Dr. Jennifer Pugh. I'm one of the Chief Service of Emergency Medicine at ECMC. Again, our team worked together to provide care for all 24 patients coming in. We currently have 20 of those patients actively receiving treatment, imaging, evaluation by the trauma service in the emergency department, and we likely have updates later. 2 went to I believe the operating room, and we have but luckily, again, with the team, many of our emergency medicine physicians from our group on scene and those who joined us in the department, we were able to take care of all patients very quickly.
Thanks, Dr. Pugh. And our next speaker is our Chief of Surgery, Dr. Jeff Brewer.
Yeah, so I just want to echo what Dr. Cloud and Dr. Pugh stated. You know, it takes an army to mobilize what is essentially usually a full hospital and make space for 20 plus victims of a car wreck. You know, the initial report was that we had 50 plus patients coming, which we would have been able to accommodate. So everyone from the housekeepers that keep the rooms cleaned and turned over so we can get these trauma bays utilized, to the neurosurgeons, the orthopods, all the physicians that came down to help out, and the nurses and staff in the trauma bays.
So now we'll open for any questions for any of the 3 physicians.
What kinds of injuries, excuse me, what kind of injuries are you seeing?
You know, with blunt trauma like motor vehicle collisions or a rollover like this, really any type of injury can be seen. So we have some folks that have some head injuries. We have some folks that have some extremity fractures. 2 patients are in the operating room right now, one with internal injuries that are being managed and one with a severe extremity injury. And then we have several folks still getting evaluated of lesser complexity still in the emergency department.
Those 2 most serious, I mean, what are their prospects at this point? Do we know?
I would expect that they would recover.
Eileen, you have a question?
Yeah, I mean, how did you make it all come together here? Just, you know, you work as a team, obviously, but just knowing how to evaluate each of those situations of what those folks had.
So we train for these. In fact, we just had a mass casualty drill in July, where we actually bring everyone together and actually run through the entire thing with patients and ambulances arriving. And then we learn from those, and we post-game those and Monday morning quarterback them and look at ways we can improve. And so that when the rubber hits the road and when the real thing happens, like today, we are prepared to be professionals and to get the patients rapidly evaluated and the ones that need it to the ICUs and to the ORs.
At the scene, this tour bus came from Niagara Falls. I'm not sure which Niagara Falls, but it came from Niagara Falls to New York City, and we were told it was loaded with people that were from the Philippines, from the Far East, from India. There was a language barrier. I would imagine some of those folks are here, and could you talk a little bit about how you're dealing with it? Is it become an issue for you, and how did you deal with that?
Many of the patients were bilingual, so they were able to provide some history in English. And then we also actually utilized all of our translation services through the entire hospital. We had brought down, so we had over 15 or 20 translation devices, actually more translation devices than patients arriving available.
Sure. I know you train for this all the time. Have you ever had a mass casualty incident with this many patients at once?
It's been a long time.
Yeah, I can.
Can you recall any others that
one
here?
without maybe not this many patients?
Okay.
You know, but on a microscopic scale, we do this every day, right? So any patient that comes in here from a car wreck or a gunshot or a fall, they're evaluated in the same way. So you're just multiplying that. And we use force multipliers by bringing all the assets we have in the hospital. So we bring all the residents down on the surgery they're in the hospital that may be on other services. All the orthopedic physicians and their residents came down. So you just magnify and multiply what you have in the hospital
Good
and
to
do the
know.
things that we do every day, just
Good-
on a
good
larger
to know,
scale.
but the question was, have you ever had an incident with this
So,
many at once?
I've been here 25 years, and, sorry. I've been here 25 years. This is, and as Peter had mentioned, I'm also a member of the Department of Emergency Medicine. This is probably the most trauma patients we've had from one incident in my career here in Buffalo,
Over 25 years.
over 25
Can you
years.
talk about the doctors that went out in the field to the scene?
So we have, or you go ahead and handle
No,
it.
I can,
'Cause it's from our department.
So UB Emergency Medicine, we cover multiple different sites, including ECMC, but we're fortunate to have an EMS division, and that group works directly with our EMS staff, and they actually deployed themselves right onto the scene. So I believe we had 6 physicians from our group there helping with the triage of patients. So they're able to go directly to the bus, actually help the EMS crews decide how serious the patient's injuries are. Other hospitals did receive patients with lesser injuries than ECMC, but all the critical patients, they were able to identify and scene, identify who would need mercy flight, and then be transferred here. So that was a huge asset, having so many trained staff on scene who have done these mass casualty drills or have been part of them, not only in New York or other states.
If you know, how many Mercy Flight landings were here today?
I believe we had 4.
4, yeah.
Just to clarify the numbers real quick, 24 patients came into ECMC, 2 of them went to the operating room, the 2 others to trauma ICU, that's right?
I believe that's
Yes.
And the remainder are being evaluated.
Yeah,
so.
we still have 20 that are currently in our department receiving active care.
Do you know the breakdown, because I've heard that, some of course went to Strong as well, and like you said, there were other hospitals involved, so do you know the breakdown as far as, how many, like the percentages?
I can't speak to the other hospitals. I know we did receive the majority of the patients from what I'm hearing from the physicians on the scene, yeah.
Were there any fatalities? If so, how many?
I will probably direct that back to the staff on the scene, but we
Yeah.
were told that there were several fatalities on the
I
scene.
think New York State Police may have that information for you from
Okay.
the scene, yes. Anybody else? I know Buffalo News just arrived, so you want to...
And I think to reiterate, I know this question was asked, but we were able, with the new emergency department, we went from a very small department in the old hospital, but now we have a 53-bed emergency department. We have 4 large trauma bays. We were actually able to clear every room with the help of our medicine colleagues so that if we did receive all 50-plus patients, we would have been ready. We're very fortunate with the new setup of even the ambulance area. We doing triage outside and making sure patients were assigned to the appropriate areas.
We actually designed this new emergency department for mass casualty incidences. That was one of the primary things we were thinking about when it was designed, so that we could have good ambulance flow and patient drop-off right next to the area where they'd be evaluated for traumas. And so I think today was proof of that concept working.
Yeah, and of all the hospitals in the market, anyway, ECMC is the designated mass casualty center for Western New York. And again, as Dr. Cloud said earlier, we are, as I think you all know, the only level 1 adult trauma center for Western New York. Oshai Children's is for pediatric cases, which would be 16 years and younger, but ECMC is for adults. Yeah. Any other questions? Thanks, everybody. We appreciate it.
Thank you.
Thank you.
Thank you. And thank you.
Yeah.
And in the advisory I sent out, the